in math. And then I moved here to Mexico back when I was in ninth grade. It was really hard for me at first because I was used to live in the United States. And I had my friends. And I used to live in California for like 2 years, and I used to live in Washington State like for around 6 years. 4 years. And it was hard for me. It took me maybe 3 years to get used to the fact that I was living here back in Mexico. And well, I wanted to be a doctor since I was a kid. I was always drawing hospitals like with my um, last name on it. And then I got to medical school, and I really wanted to be everything. I wanted to be surgeon. I wanted to be a neurologist. I didn't really know what I wanted to be till I finished medical school. And I like the fact that when you have critical patients, you can do actually something for them. You can um, stabilize a patient and make the difference. That's why I decided to study emergency medicine. And now I'm in second year emergency medicine resident. It was hard, but I'm here, still alive.
Can you tell us what a day in the life of your job is like? Like, what is it like? Where do you work? Are you working in Guadalajara? Are you working in, somewhere else? What does that look like?
I worked in Guadalajara for the past 2 years, and we have the emergency room. We have around 60 patients every day. Just because of the COVID situation, we have now like 25, maybe 30 patients because I think patients are a little bit scared, I suppose. So we have a little bit less patients than before. Like people get to the emergency room. We stabilize patients. Like they get to the room. We evaluate the patient. Sometimes we get to intubate patients, and we have to how can you call it? Como ponerle tubos torácicos.
Okay. So like putting different tubes, making sure that you stabilize the patients. Is that what you're saying?
Yeah.
Okay.
Like when they have pneumothorax,
Uh-huh.
you actually have to make an incision on the thorax and introduce like a thoracic tube. Maybe? No?
Okay. No, that's okay. So going back really quick, you were sharing that when when different patients come in, you check whatever is wrong with them, right? Because you work in the emergency room.
Mm-hmm.
And so you check what they have and then help stabilize them so they can feel better is what you were saying, right?
Yeah, so yeah, we get people unconscious, and we have to make a team with nurses. We have to stabilize the patient, make sure they are. We have a airway protection, so that's why sometimes we have to intubate, and sometimes you have to take labs, maybe take a TC.
What is a TC?
Una tomografía, like
Is that like a certain test you have to take?
tomography,
Say that again?
una tomografía, tomography.
Tomography? And what does that do? Is
CT.
that, oh, a CT scan.
Yeah.
Oh, okay. So, I don't know if any of you guys are aware what a CT scan is. If you are, you can give me a thumbs up. If you are not, maybe we can explain it a little bit more. And then if any of you have questions while we are talking, please feel free to add them in the chat box. And then we'll be sure to ask your questions. Okay, perfect. Sorry, Doctora Yareny. If you can please keep going. Sorry, I didn't mean to interrupt you. You were saying that you know, what you do in the emergency room. Can you please share what your first day as, I'm sorry, let me go back to what was your first day as an emergency medicine physician like?
It was scary. It was really scary because at first I didn't know how to make advanced advanced cardiology. I call it advanced cardiology life support.
Uh-huh.
It was hard. Estaba, how can you call it? Estaba en paro el paciente.
Oh, so they were having cardiac arrest?
Uh-huh.
Uh-huh.
He was really, estaba todo frío.
Okay. So you had to.
He was really cold. He was in cardiac arrest. I didn't know how to act. Um, my 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 classmates were there, so we started compressions. But it was really hard because at first you have to get used to having critical patients and act fast. You have to actually do things with your head, with your hands. You have to think. You have to do everything at the same time. You have to organize your team, and it's really really hard. You actually have to get used to the fact that you have critical patients. You have to organize your team. They have to work with you. You have to make sure they doing what you told them to do. Um, because you know when you are like maybe the surgeon, you have to well you have to work as a team, but it's different because you have a patient which you know what he has, and maybe if he's diabetic, if he has hypertension. But when someone gets to the emergency room, you don't know what that person has. You don't know what happened before. Sometimes you don't know what happened before he got to the hospital. So you have to figure out what the patient has, stabilize your patient. Sometimes it's very hard.
Thank you. The next question is, where did you attend medical school?
Universidad del Valle de México here in Guadalajara.
Okay, I'm going to say that a little bit slower for anybody who did not hear that. So it's Universidad del Valle
In Mexico.
de México in Guadalajara.
Uh-huh.
Okay. And then how long did it take you to finish the schooling?
4 years and a half. Then I have to do a whole year in the hospital, in a hospital for something like social service, and then you have to do another year of social service. So I had to do it took me 6 years and a half to finish medical school.
Thank you. And so that was the next question. It was, how many years did it take to become an emergency medicine physician? So you would say,
3 years.
I'm sorry?
3 more years.
3 more years, so 9.5 in total?
Yeah.
From the moment you started your schooling to now?
Till now I have 8 years and a half, and I still have 1 more year to go.
Okay. And then you'll officially be an emergency medicine physician.
Hmm.
Okay. Thank you.
And
Uh,
I want to get in intensive care
okay. So then continue studying afterwards.
for another 2 years.
Okay. And what is that? What's the difference between the emergency medicine physician and then continue studying for intensive care? What is that like in Mexico?
And well, first of all, you don't work in an emergency room. You work in intensive care unit, and you get paid much better. You actually have less patients. In an emergency room, you actually work with around 60, 70 patients. In the intensive care unit, you actually work with around 6 or 7 patients. So the work is less. You actually work with almost all intubated patients at work.
And that's when you continue studying after already being a emergency medicine physician? Yeah? Okay. There's a question that says, how was studying for the MCAT? So in Mexico, do you have to take the test, the MCAT?
It's called El Nacional.
Okay.
To take a test, in, it takes like around 7 or 8 hours. You have to answer around 450 questions about everything you learn in medical school, and then you get your score at the end of the of your test, and they call you to well, they send you a message, and you if you're in or out, like a month later after the test.
How long did you take studying for the test before it?
Whole year.
A whole year before you took the test? And then did you have to pay for it?
Yeah, around 400, not like $200,
US dollars, 200 US dollars. Okay,
4,000 pesos. Around.
4,000 pesos. Yeah? Okay. Thank you for sharing that. So here's the next question. What kind of sick patients do you take care of?
Um, all type. In the emergency room, you actually get to see everything, and I don't get to see pediatric patients right now, but in public hospitals, you actually have to see pediatric patients. I have to take care of um, strokes, um, cardiac arrest, um, pancreatitis, uh, pneumonias,
Pneumonia? Okay.
pneumonia.
Thank you. So the next question is, do you think becoming a physician is easier in another country?
Well, probably because you have everything you need for your for your patient. Sometimes here in Mexico, we don't get to have everything. It's kind of hard because I mean, like um, you have 60 patients, and probably you have like four doctors for 60 patients. I don't think that situation happens in other countries. Sometimes you don't have maybe simple things like Advil, or you know CT scans. Sometimes the machine doesn't work. You have to take the patient to another hospital. Um,
Do you think that that makes you have to problem solve and be on your feet more?
Yeah.
Yeah, all the time. So it's like a big puzzle that you have to figure out.
Yeah, you have to actually do everything. I mean, administrative issues. You have to take care of the patient. It's kind of hard, really hard sometimes.
Okay.
Because sometimes, I mean, I'm a student, so I have to be with like you're attending. Sometimes the attending doesn't get go to work, or maybe he asked for permission, or maybe he didn't just show up and just call later to say that he can make it. So that sometimes it's hard for you because you have to take care of the patient. You don't get to say no, I'm scared. I don't want to be alone, or I need my attending. No, you have to do the work and make sure everything goes well with with your shift.
The next question is, how did you know that you wanted to be an emergency room doctor and not any kind of medical care, not any other medical career, like a nurse or something? Like, why did you want to do emergency room doctor?
Because when someone is in a cardiac arrest and you actually get to take the patient out of cardiac arrest, it gives you, well, it gave me happiness. I was really, really happy. I was excited. And that's how I knew I wanted to do um, an emergency medicine doctor.
Thank you.
I mean, it's
Then
really exciting when you have a really, really um, critical patient and you actually get to take the patient out of critical care and that person goes home with his family. I mean, that's really exciting for a doctor.
Thank you. The next question is really sweet. They wrote it in Spanish. So I'll read it in Spanish and I'll translate it. You can answer it in English or Spanish, whichever you want. We can translate it afterwards. So the question is, ¿había otra especialidad médica que le interesaba? And in English is there any other specialty in medicine that interested you? For those of you that can't speak Spanish.
Hugo, I get to answer in Spanish or
You can, I can translate it.
okay. Pues al principio me gustaba mucho cirugía oncológica. Quería ser un oncólogo quirúrgico. Y la razón era principalmente porque es muy bonito cuando una persona está destinada a lo mejor a morir, que tú puedes hacer la diferencia. Es muy satisfactorio. En el internado yo hice una rotación a cirugía oncológica y realmente sí me gustó mucho porque hay personas que realmente lo único que necesitan es a veces, bueno, sí, quitarle el tumor, pero también esas personas necesitan a alguien que a lo mejor les sonría, que la hagan sentir un poquito mejor. Es un grupo de personas que son muy agradecidas, te hacen sentir bien también la forma en que ellos actúan contigo y a veces eso no lo recibes en otro tipo de pacientes.
Thank you. So I'm going to translate what she just shared. But she said that the other interest field that she was looking into was oncology. And she did have a rotation within her medical school, like internship afterwards. And she liked it, but she didn't think that that was specifically for her. That's just one of the specialties she looked into. So thanks, Yareny. So the next one is, why do you think the United States medical bills are more expensive than other countries?
Um,
And if you don't know the answer to some of these, it's okay.
well, we have a theory here in Mexico about that. United States doctors, they actually don't get to talk much with their patients. That's what we think. They don't get to maybe think different diagnoses before taking CT scans or maybe labs, and y eso that makes everything much more expensive because they actually have to make a lot of tests before knowing what the patient really has. We here in Mexico, since we don't get to have a lot of budget for maybe tests, we actually get to really be kind of like a detective with the patient. We have to talk to the patient. We actually have to ask what happened with maybe 2 months before he got sick. You got to se llama como hacer más clínica, like be a little bit more clinic than actually
So you have,
taking tests.
so you have
No,
to be, are you saying that you have to be more involved and ask a lot more questions and get to know the patient more because you don't have access to all the resources like the tests that have to get done? Is that what you're saying? Okay, thank you. That's a good theory. I don't know if we would ever test it, but interesting to know what, people in different countries think. The next question is, what's your plan after you finish your residency? We have a lot
why
of questions.
I want to be a critical care physician, so I have to. That's gonna take 2 more years of training. I can't hear you.
Sorry. After you treat a patient in the emergency room, where do they go?
Well, the first thing you do in the emergency room is to stabilize your patients. Sometimes they go to surgery, maybe to a critical care unit. Sometimes they get to get home because we stabilize. The patient is okay. He can maybe go home. Sometimes they don't have available rooms in the hospital. Like we are full sometimes. So the patient is supposed to take around 8 hours in the emergency room and then go to wherever place he has to go. I mean, to maybe operating room or uh, maybe to uh, internal medicine floor. But sometimes it takes a lot of more days because we don't have rooms available for the patients in the hospital. So it's a little bit hard.
Thank you. The next question is, this is one of my favorites. What is your favorite or most valuable memory that you have had?
Mm,
Or maybe one that you can go back to and say, I'm never going to forget this, or I'm never going to forget this patient, or something like that.
it's kind of hard because every shift you get to see something, and that's kind of hard. But maybe the first time I figured out that I wanted to be an emergency medicine physician because the patient was in a cardiac arrest and we took the person out of cardiac arrest, and that was really pretty exciting for me.
Thank you. I can see the happiness in your face. So we have three more questions, and then I have an extra one. So what advice would you give to yourself when you were younger? What would you do different?
Mm, Sometimes when you're in medical school, you have to study every day, but it's kind of hard because you get to go home and be very tired. So sometimes it's hard studying every day like you're supposed to do. But I think it's much more easier when you study every single day, just for maybe around half an hour, maybe 1 hour. Then maybe studying at the end of the semester or every weekend, because it was hard studying everything at the end. So when you get to study every single day, you actually feel like you have to study. I mean, if you, maybe you have to go to your friends, to your family, but you know you have to study, and that makes the difference.
Thank you. What would you say are some of the consequences of failure? Whether that's, when you're at work or in medical school, what are your personal thoughts? What are the consequences of failing?
Well, for me, since I wanted to be a doctor since I was a kid, it was like I can have to be a doctor. I have to make my best. So I remember one time I had like around 4 quizzes the next day, and I was really frustrated. I was actually crying because I didn't know how to study for 4 quizzes, different quizzes. But I was like, okay, you have to calm down. You have to think positive, and you need to start studying. Everything's gonna be alright. I mean, there's no way you're gonna fail that test. So you have to be very persistent in the medical um, in medical school.
Thank you. The next question is, have you ever felt discriminated against because of your gender?
Yeah, especially here in Mexico. Yeah, people sometimes they just because you're a woman, they think you're a nurse. Sometimes they see a man, nurse man, and they call him doctor. Just because you're a woman, they call you a nurse or lady, and that really gets on my nerves every time I hear that. I remember one time in the hospital, one resident, she was really, really, really mad because a woman just called her lady, and she answered like, just because I'm a woman, you think I don't get to be a doctor? And she's right. Just because you're a woman doesn't mean anything. You can be anything you want.
Thank you. So the next question, again, it's in Spanish, but you can answer it either way you want, and then I can translate it. So it says, ¿Cómo ha sido tu residencia con la situación de COVID-19? So how has your residency been with the COVID-19 situation?
Okay. Pues ha sido muy difícil porque, por ejemplo, cuando se supone que cuando estás en la residencia rotas a otros servicios. Por ejemplo, estás en la residencia y tienes un hospital de base, pero vas a más hospitales. Por ejemplo, a lo mejor a pediatría, a toxicología, a diferentes especialidades o como ramas de la misma especialidad. Te vas a lo mejor por un mes, por 2, y regresas otra vez a tu hospital. Pero con esta situación, lo que ha pasado es de que no llegamos a ir a ninguna rotación, tenemos que estar en nuestro hospital. Entonces ha sido difícil porque pues tienes que quedarte todo el tiempo en el hospital, o sea, y se supone que tú debes aprender cosas diferentes. Luego, por ejemplo, en el área de urgencias, ahorita se está dividiendo a los pacientes. Se divide a los pacientes que son positivos o sospechosos y con los pacientes que no son sospechosos, o sea, que son pacientes que no tienen COVID. Entonces, hay algunas veces que llegan los pacientes, mienten, dicen que tienen algunos síntomas y al último resulta que a lo mejor sí son sospechosos. Y si no traías protección, tu cubrebocas, tu protección para los ojos, a lo mejor ya te infectaste. Entonces tienes que tener mucho cuidado con los pacientes, traer siempre tu cubrebocas porque los pacientes mienten, nomás por el miedo de que a lo mejor se infecten. Luego tienes que usar el equipo de protección. El equipo de protección es muy, muy difícil traerlo porque, bueno, como que al principio te tienes que acostumbrar. La primera vez que yo entré al área de COVID, te mareas. Yo me sentía como que me mareaba, como que me faltaba el aire, como que no podía hacer nada. Y ya después me tranquilicé y me empecé a, pues a respirar, a hacer mi trabajo. Entonces ha sido muy difícil. Ahorita, por ejemplo, en vez de ir al hospital entre semana todos los días, tienes que ir, por ejemplo, cada 4 días, durar 24 horas de turno. Te tienes que meter, ponerte todo tu traje, o sea, en cuanto te dicen, te tienes que meter. Eh, y pues es difícil porque a veces sí te da miedo.
Okay, thanks. I'm going to translate everything you said in a really short section. So basically, what the Doctora Yareny has been sharing is that usually in rotations, they're able to go to different hospitals within the same specialty, or maybe they get to try different specialties. So they get to see toxicology, or maybe they get to go to pediatrics or something different outside of what they are currently working on. But because of COVID, they're not able to rotate and go to anywhere else. They are assigned to one specific hospital. And then she was sharing that at the hospital, they basically code patients into two different like categories, which is positive or suspicious, and then not positive. And so she's sharing that the doctors have to wear certain protective equipment, and sometimes it gets really hard because it's really hot or it's something you're not used to. And she said that the first time she ever had to wear one, she was a little dizzy because she was really, really hot, and you can only imagine carrying a bunch of extra equipment on top of your regular clothes. And then the last thing she shared is that it's really important that she keeps all of her PPE on, because if she does not, then there's a good possibility that she could get infected with COVID. So it's definitely changed what a normal rotation, or what was the word? Residency looks like. So
Yeah, and it's especially hard because the patients sometimes lie. So you have to be with your um, special equipment the whole time. So it's
okay,
really, really, really hard.
thank you. So the next question is, who inspired you to become a physician? Was there a certain person? Was there a show? What was it?
I really don't know. Since I was a kid, I wanted to be a doctor, so I really don't know what I saw or heard. I just knew I wanted to be a doctor.
Okay, the next question is, how did you feel leaving friends and family to study in a different country? How did it make you feel?
Pretty hard because you get to you're used to living in a specific place, and then you get to have new friends or maybe different school. Sometimes it's kind of hard to socialize with different people for me. So it was really, really hard at first.
Okay. Um, Two more questions. The next question is, what is, sorry, hold on. What is your favorite thing about Mexico? That's the first question.
Well,
You
I
could say
think
everything.
food, Mexican food.
Okay, Mexican food. And then the next question is, what type of subjects did you learn in medical school? So was it like anatomy, physiology, like what was specific in your medical school program?
Anatomy, uh, patho, physiology, um, uh, biochemic. Uh,
Was the last one biochemistry? Is that what you said? Biochemistry?
Biochemistry. Um, a lot.
Would you say
Pues,
those are the main ones?
yeah.
Okay. So I have a quick question, and this is my personal question, and maybe people on the call will understand what I'm talking about. But when I think about an emergency room, I think about Grey's Anatomy. Is there any like resemblance, anything similar? Is because some people want to go into the medical field because they watch shows like that. So is that anything that you would reference?
Yeah. The only thing we don't do is we don't get to operate people. That's the only difference, maybe. But it's the same dynamic. I mean, people get to an emergency room, you have to stabilize the patient, you have to maybe get to take the patient to operate. But as an emergency medicine physician, we don't get to operate. That's the only difference. That's not true.
Okay, thank you. The next question is your outfit reuse? Oh, it's in Spanish. Sorry, I will ask it in Spanish. So is your outfit reusable? ¿El traje es reusable?
No,
The one you wear.
no, you get to use a different one every time. Uno diferente cada vez porque no, cuando te lo pones, pues ya está contaminado. Hay personas que sí les ponen cloro y lo vuelven a utilizar, pero en el hospital no hacemos eso. Bueno, en mi hospital, no sé si en otros hospitales sí lo hacen. En cuanto te lo quitas, lo tiras.
Thank you. And then I want to clarify something. Were you saying earlier that you work 24 hours? Like, is that your shift?
Yeah,
Okay. So every how often? Like in 7 days, how many days of, how many full days do you work at a hospital?
I have to work for 24 hours and I get to rest for 3 days.
Okay. So you work, like, let's say you worked yesterday, you would be off today, tomorrow, and the next day, and then you'd go back
I have to work on Friday.
for 24 hours.
Mhm.
Okay. Thank you. Okay, if anybody has any more questions, I will encourage you to add them in the chat box. We had a lot of really great questions during this whole session. If you do not have any questions, that's okay. We will wrap up in a couple of minutes, but I want to give you one last chance. If you want to unmute yourself, you're welcome to do so also. But again, Yareny, is there any other piece of advice you would give to these young students who are in high school, who, you know, maybe they are interested in, you know, getting their bachelor's in the United States and then going somewhere else like Mexico or maybe a different country to get their degree? You know, what would you suggest? Did you know anyone who did that? Did you, what's your piece of advice?
I know a lot of people from the United States that come to Guadalajara because it's less expensive than the United States, especially Universidad de Guadalajara, La Autónoma de Guadalajara is much more less expensive, uh, but if you're here in Mexico, it's really expensive. But if you um, the prices here in Mexico are much more less expensive than the ones in the United States. That's what I know about that topic.
Do you know by any chance approximately how much like it cost to go, maybe for a year or maybe for the whole program?
No.
No.
I'll ask.
Okay. Yeah. And then, like I said, any other piece of advice you want to share with students who maybe are interested in going into being a doctor?
You have to be very persistent. School is hard. You sometimes you want to. go home and maybe just cry a little bit. But you have to be very persistent, and you have to uh, set up your goals and accomplish them, which is really, really hard. You have to be very persistent because nothing is easy. Even if you work, maybe you don't go to school, like you don't go to college or anything. Even work is hard. Everything is hard in life, and no one is gonna give you anything. So everything is gonna cost you.
Thank you. And then do you think there's another question, but I want to ask you if you wanted, like, let's say you're done, you know, if you're in Mexico and then you want to come back to the United States, can you come be a doctor here or no?
Yeah, but I have to take around three different tests. Step one, step two, and step three, and it takes a lot of time. So
Can you repeat that really quick? You cut out. You said you have to take 3 tests and what?
you have to take three different tests. Step one, step two, step three, and do your residency one second all
Wow.
over.
Okay.
So
So
no,
you
I'd
want
rather
to
stay
do
in
it,
Mexico.
but it is possible. Okay, so this is oh, I'm
Canada
sorry.
is a little bit different. You actually have to take one test, and then you become a specialist
Okay.
in that country.
Okay, thank you. So I'll do this last question and then we will call it a day. But the question is, um, if you study to be a nurse, this is not specifically to being a doctor, but if you study to being a nurse and earn money, that way you can study to be a doctor. Would that still mean there's a lot to study for? I think I asked that correctly, Jericho. If I did not ask that correctly, please let me know.
Yeah, it's a lot of different, very different. Um,
It's
as a nurse, well, my opinion, you know how to take care of a patient maybe, but they don't get to study as much as a doctor. Um, maybe they get to know some stuff about anatomy, but as a doctor, you have to learn a lot more about everything. Maybe we don't know how to probably administrate something like a nurse, but they don't know. I mean, they're almost the same, but not the same. You actually get to study a little bit different in every field.
Thank you. And thank you, Jericho, for clarifying that I asked it correctly. So we are going to head and wrap up the recording. So I'm going to press stop now.